Time starts now.
What is it?
A 46-year-old male patient comes with a hip pain. Yes.
Hi, Mr. Smith.
Yes.
I'm
I will
Dr.
shake with them because
I'm Dr. Dhanisar, and I'm taking your history and examination today. Let me just put a drape on you.
Sure. Thank you, doctor.
So, Mr. Smith, what brings you to the hospital today?
Doc, I have the hip pain.
Okay. Can you please localize something?
This is here.
Okay. Could you please elaborate? Since when have you been experiencing this pain?
Oh, doc, this pain has been going on for the last, I think, a week or two.
Week or two. What were you doing when this pain started?
Nothing, doctor. Just walking.
You were walking.
Yeah.
And what type of pain would you say it is?
It's a throbbing pain.
It's a throbbing pain. Is it radiating somewhere?
I don't know, doctor.
You don't know. Okay. Do you particular time of the day when you experience the pain the most?
Oh, doc. The pain is like more in the morning.
In the morning. Does the pain come and go or stays throughout the day?
It gets better when I walk. So morning it is more, then it starts going down.
Anything you do that decreases the pain?
That's it.
Anything you do that increases the pain? No. Do you have any kind of numbness or tingling in your lower extremities?
No.
Is there any history of trauma there?
No.
Do you have any previous episode of such pain?
No.
Never? Okay. I'm just getting so conscious that my arms are being counted. And how would you rate the severity of this pain?
7.5.
Do you feel, during walking, do you feel the pain? Do you have any kind of pain in your back? Nothing in the back. Do you have any other problem that you would like to tell me about? Okay. Do any other medical illnesses that you have? Nothing? Any kind of surgery that you might have undergone? How's the sleep?
Since last 1-2 weeks, it's bad.
It's bad because it hurts at
Yeah.
night. Okay. And during the morning, how long does the pain last? Like,
Oh, it's just, then I do 2-3 hours in the morning, and then it gets better, and when I go to bed at night time, I cannot lay on the same side.
okay. Have you noticed any kind of skin changes?
No.
Okay. Any kind of vision changes?
No.
Okay. Do you have any problems with urine?
No.
Or bowel?
No.
Any kind of abdominal pain? Do you have any kind of swellings?
No.
Okay. How do you experience any kind of reflux? Okay. So, Mr. Smith, in your family, does anybody have similar conditions?
No.
Any kind of thyroid problems?
No.
Any joint pains in your family?
No.
High blood pressure?
No.
Or blood sugar?
No.
So, Mr. Smith, I will be asking you about your social history. What do you do for a living?
Oh, I'm a sales agent.
Sales agent. Are you sexually active? Sexually active.
What does the sales agent have to do with the sexually active thing? So you didn't even ask the transition question. This question will be confidential.
Okay.
So you have to transition properly, like sales agent, are you sexually active? Doesn't make sense to me. So you have to have the transition.
So Mr. Smith, I'll be asking you some personal questions, and I assure you they will remain confidential. Are you sexually active?
Yes.
Can you elaborate on your partner?
My wife.
Do you have any history of sexually transmitted disease in the past?
No.
Okay. Do you use alcohol in any form?
Mm-hmm.
Do you use tobacco in any form?
No.
Oh. Do you use any kind of recreational drugs?
No.
Any kind of vaccinations? Are you up to date with the vaccinations?
Yeah.
Do you feel fatigue?
No, it's just last 1 or 2 weeks, that's it.
Do you exercise?
Sometimes if I can, no time.
Okay. How's your appetite?
Fine.
Okay. Do you have any worries that I might have missed? Okay.
So go ahead.
So Mr. Smith, from the history that you have given me, it seems like this hip pain from 2 weeks has been bothering you and causes you to have difficulty falling and maintaining your sleep. And do you have any questions?
No.
Other questions? So I will be checking your muscular strength and your reflexes, if you may. Please let me know if you have any kind of pain. Do you have any pain here?
No.
Any pain over here?
No.
Any pain here? Pain here? So, checking for reflexes. So I will be scheduling an exam for your pelvic area in the next meeting. Okay. And for now, I'll be checking your arms. Do you have any pain here? Do you have any pain here?
No.
Could you please walk for me? Okay. Thank you very much. Thank you. Okay. I'll be checking your strength of the muscle. Can you please squeeze my fingers? Okay. Can you open your hands? Okay. Can you, yes, do like this. Push up, push down. Okay. Can you push up? Okay.
This I cannot do.
Okay. So, and I will be examining your, do you feel sensations here?
Yeah.
Touch.
Mhm.
Okay. Here. Over here. Here. So, Mr. Smith, from the physical examination and your history, I'm of the view that you might be having the joint pain might be due to some kind of autoimmune disorder. But for that, I need to you to undergo some tests like rheumatoid factor and anti-CCP to further narrow down the diagnosis. And as you have no other conditions like shortness of breath or GERD or anything, it rules out your probability to have conditions like associated with rheumatoid arthritis.
So why did you not examine my back? Why did you not do internal rotation and external rotation? Why did you not ask me the joint, one joint above and one joint below?
Ankle pain.
You
Sorry,
the
a knee
knee and the back, this hip. I said over here. I told you yesterday.
Yes.
Hip can be confused with the buttock and the straight leg
But
raise.
I asked that do you have any other pain?
No, you have to be specific back pain. I don't know. I don't have any other pain. You have to be very precise. One joint up and one joint below. You have to ask.
Okay, I have.
I feel ask that because any joint, if the knee joint, you have to ask for the ankle, and this you have to ask.
I didn't ask because I put an open-ended question. Like, do you have any other pain?
No, I want you to remember this. This is the very, very important question. One joint above, one joint below. You have to ask. You have to do external rotation and internal rotation. You have to do straight leg raise. Because how will you come to know? Yes, I understand you're not supposed to examine the hip, but still you can do straight leg raise, right? So, and that's very important, straight leg raise. So, this is trochanteric bursitis. This is your buttock and the SLR, right? And then this, you asked me numbness and tingling, that's fine. But then you have to ask specifically for the groin pain.
Thank you for watching the video. Enroll now in our Lean Patient Experience Certification course, link in the description below.